And I will go ahead and introduce our first speaker. We have the Honorable Mayor Scott Getchman to say a few words on behalf of the city. So Mayor Getchman.
Thank you, Tara, and thank you all for attending this afternoon. This is an extremely important meeting. Collaboratively, we continue to navigate the pandemic. Our message today is about the choices we make to deal with COVID-19, the safety and the greater good of our healthcare providers and for our entire community. Our goal is to not go backwards as a community. We don't want to shut our economy down. However, we have to take the virus and health directives seriously. If not, we'll continue to compromise our healthcare system and our healthcare workers. Please take today's messages and the information seriously. Avoid crowded spaces, avoid close contact, wear a mask or maintain 6 feet of distance, avoid enclosed spaces with poor ventilation. The positive choices we make today will save lives for tomorrow. At this time, I'll turn it over to Tara. She's going to give us an overview of everything that's going on in Dodge County.
All right. Well, good afternoon, everybody. My name is Tara Ewing, and I am the Health Director for the Three Rivers Public Health Department. So thank you very, very much for joining us today. I am going to go ahead and share my screen. Can you guys all see that? Okay. All right. So really what the purpose of this is I want to give everybody just a good idea of where we are in regards to our cases and what this potentially means for our community. So first and foremost, I want to share with all of you that we have our Three Rivers Public Health Department case dashboard that is available 24 hours a day, 7 days a week. So for the most latest up-to-date information, you would just need to go to that dashboard to get that information. To do that, and these will be available after the presentation today, but you can go here and you can see exactly what we have going on within our Three Rivers Public Health Department. We have 3,645 cases total, and that does not account the cases that came in after 5 o'clock last night and the cases that we've had today. In Dodge County alone, we've had 2,044 cases with 1,336 cases that have been recovered and 27 deaths. And unfortunately, I will be announcing another COVID-19 related death here in the next day or so. Out of those 2,044 cases, 263 of them have been in the last 7 days, and 457 of them have been in the last 14 days. What we are seeing is, as you guys can see, and you can click on this and hover and use any of this information when you guys have time, but you can see our biggest age range is the 20 to 29 age range in Dodge County, followed by the 30s, 40s, and 50-year-olds. And then now we are seeing an uptick in the 10 to 19-year-old age range with 247 cases. I'm going to go ahead and just switch back to my PowerPoint just so we can kind of go through some of this. So I want you guys to know this dashboard, and we're constantly revamping it. So please feel free to look at that at any given time when you need information. Hold on here. Okay. All right, this here, and can you guys all see 3R PhD current case rate graph? I think. Can you see that, Tara?
Yes, now we can.
Okay, perfect. All right, so I'm gonna have to stick in this format because it's not letting the other one. This here is really, this is what we've seen, and this is the trajectory of what has happened in the overall Three Rivers Public Health Department since the 12th of October. As you guys can see, the bottom here are the dates, and this blue line here is our number of cases per day, and the green line is really our 7-day rolling case average. When you look, yesterday we ended at 99.80 cases for our 7-day rolling average. Okay, just to give you guys kind of an idea of what this looked like back in April. Once again, at the bottom, we have the dates. The orange is the positive cases and the blue is the negative cases. So you guys can see we had just a few cases, nothing too major. I will note that the 26 cases that we had on April 23rd, that's when we didn't have a lot of readily available testing. And so what would happen is we would do targeted testing, and that would be around people that were symptomatic or connected to a case. If you guys look, this here shows the month of July. Once again, the orange is at the bottom. Those are our positive cases. So we had a pretty darn, really low positivity rate, depending on kind of the, some of those days. But as you can see, our cases were very, very manageable. Then you get into, once again, October through yesterday, November 9th. As you guys can see, we had a pretty significant day on October 23rd. And that started to kind of kick us off with just an uptick in cases. Then from there, we moved to October 30th, and then really increased significantly this past weekend on November 6th. I wanted to give you guys just kind of a brief overview of that because I wanted you guys just to see the difference between the overall health jurisdiction and what we have going on specifically in Dodge County. So this is March. As you guys can see, March was basically non-existent. We had just a couple of cases within Dodge County. Then we get into our 7-day rolling average. As you can see, number of cases, our 7-day rolling cases, we're at 2, we're at 3, we're at 5. Compare that now to 99.80 cases as our 7-day rolling average. This here, once again, is Dodge County specifics. This is our Dodge County July case rate graph. So it shows you, when we looked at those cases that we had back in July, the first one that showed the overall health jurisdiction, this just shows us that the cases were completely manageable and we didn't have a lot of them at all. And then we get into our 7 days rolling average. So this here starts in October. You guys can see just for Dodge County alone, we are sitting at about 50 cases as a 7-day rolling average, and these are the number of cases. So I just alluded to back on November 6th, we had 131 cases for the entire health jurisdiction. Out of those 131 cases, 72 of them were in Dodge County. Then we just go back, we look a little bit at March, we look a little bit at April, just to try to demonstrate that we had cases. It was completely manageable, and we were in a pretty significant lockdown at that time, trying to really learn and understand more about this virus and what it all entailed. Then we get into July. The blue is the number of tests that were performed. So I will also just remind all of you that we worked with each of our 3 healthcare systems in the 3 counties and Methodist Fremont Health here in Dodge County to set up Test Nebraska sites so that individuals would have access to affordable testing that didn't cost anything on a consistent basis. And I'm happy to report that's why we saw, some of the uptick in testing, because we don't understand what that positivity rate looks like or what the number of cases look like until we had some sort of testing that was available that we could get out there to really understand what was better, what was happening. As you can see today, our positivity rate is not doing well. Since October 12th, we started on an uptick. October 23rd, we had a very, significant uptick. And then I would tell you in the last 7 to 10 days, it's continued that way. We have more cases than we know what to do with. We are actively trying to contact trace all of our cases. And we also have the state helping us with the contact tracing because there are so many of them. I would tell you as we look at this and as we try to move forward, we need everybody to do their part, because if they don't, we're not going to be able to get through these next 2 months. The things that I would tell you is, and it's fairly easy to help us get through this. If you're sick, we need you to stay home. If you've been tested for COVID, we need you to stay home. And right now, we also need people to understand that you cannot test out of COVID. And just because you would test now after a possible exposure doesn't mean that you won't be positive tomorrow. We all have a part in this, and I am pleading with you. We've got our kids in school, and I have kids in school in all 3 counties. And if I would have known then, back in March, what I would know now, it's been so tremendous because of the collaborations with our schools. I would tell you, our kids being in schools is probably one of the best things that we can have. We know that these kids are masking. We know that there's mitigation efforts that are being implemented by the schools. We know that there's social distancing, and we know that there's cleaning and there's sanitizing going on. Unfortunately, what's happening is when these kids leave school or when they leave their activities, they're going home, and it's at times what I would consider a free-for-all. I have 20 kids that are positive right now in one school, and 12 of them went to a gathering at Bella's Pumpkin Patch on Halloween. You know, I know we all have COVID fatigue, but it's those types of gatherings then that come back when we start exposing people at school that make it really hard for me to keep convincing our schools that we need to be open. The other thing that I want to tell you too, in regards to our food production facilities, you guys are doing an absolute tremendous job here within Dodge County. I can tell you that the cases that we are seeing are not heavily tied to the food production facilities. In fact, I can tell you that really the folks that we're seeing are primarily 30, 40, and 50-year-olds. And sometimes there's ties to it, or ties to things in the community, and sometimes there's absolutely none. But I would tell you, it is not centered around any of the food production facilities that we have. And we get that question a lot, and it's really unfortunate because they are doing such a tremendous job in their organizations to keep all their employees as healthy and safe as they can. And then last but not least, I also want to talk about the tremendous partnership with Midland University. You know, we've had some questions about, you know, are there cases because of Midland? I would tell you once again, the work that Midland is doing is absolutely tremendous. And the fact that we're able to keep college students going to class, keep their activities going, has been tremendous for our community. I'm not going to tell you that we don't have cases ever in the schools or cases ever at the college, because that just would not be true. But I can guarantee you that if we didn't have these activities in the schools and the collaboration and the partnership, especially with the university, we wouldn't be where we are today. So I guess I'm pleading with everybody, please help us to continue to keep these kids in school, to keep our communities as healthy and safe as we can, because we are all going to need to do our part to get through these next couple of months. And that's all that I have.
Right. Thank you, Tara. Brett, do you want to give an update from Methodist Fremont Health, please?
Yeah. So again, I'm Brett Richmond, President and CEO of Methodist Fremont Health. This year, 2020, actually marks our 80th anniversary of serving Dodge County and the surrounding community. So we're pretty proud of that history. You know, Tara alluded to the fact that we had an early wave here in late May and early June. I want to talk a little bit today about kind of how all of this has impacted your local hospital and healthcare system. So that wave again hit us in late May through most of June. As Tara alluded to, it was disproportionately, unfortunately, hit our Hispanic community. And as Tara also commented on, the local food processing plants just really did a fantastic job of appropriately and aggressively addressing that situation. And we thank them for their leadership. That's, as Tara said, that's not what we're seeing today. Right now, we're facing a second, much different, much larger wave that is really our entire general community. If you look across the state right now, today, this afternoon sometime, we crossed the threshold of 800 COVID-19 patients hospitalized throughout the state of Nebraska. That compares to a number of 232, our previous peak during the first wave back in May, so more than 3 times as many patients hospitalized. The scary thing is most experts, based upon the recent case counts, project that number will double in the coming weeks. And some even estimate that number will then double again. And that's kind of a scary thought for many of us. From a regional perspective, we are part of the Omaha Healthcare Coalition. It's the hospitals and health systems in Douglas, Sarpy, Dodge, Saunders, and Washington County. As a coalition, we don't report our numbers individually, we report them collectively. But as of this morning, we had 372 COVID-19 patients hospitalized in those 5 counties, including Methodist Fremont Health. That's an increase of about 50% in just the last 14 days. And about 1/3 of those patients are in our respective ICUs. I will give you some more general numbers from a local Methodist Fremont Health perspective. We've now cared for, you might be surprised, we've now cared for well over 100 hospitalized patients here in Fremont at our facility. And today we are yet again at a record number of inpatients with COVID-19. We're pretty proud of the fact that we are caring for the sickest of those patients. I think sometimes there's a perception that if you're really sick, you end up in Omaha at the Med Center or Methodist Hospital. And sometimes that's the case. From a COVID perspective, we're treating the exact same patients as those facilities are. Our patients are just as sick and in many cases sicker than what they're seeing in the Omaha market. We're using all of the same therapies and treatments that Nebraska Medicine and others are and that you see on TV. Right now, we're also treating on average about a dozen patients a day through our emergency department. In the last couple of days, we've seen as many as 25 people show up in our emergency department in a 24-hour period seeking care for COVID-19. And so, you think about all the patients we're seeing in our hospital, all the people coming through our ED, and that is on top of the volume that we would typically see on any given day. And as most of you realize, we're getting ready to go into the cold and flu season. So it's interesting to think about what that might look like. So the reality is, our hospitals, all the area hospitals, Omaha, ourselves, are stressed. More importantly, I would say our care providers are stressed, physicians, nurses, therapists, and they are stressed at a point in time in which, as I said earlier, we expect these numbers to double and maybe even quadruple over the next several months. I know you guys know a lot of these people. They're your friends and neighbors and family. They sit beside you in church. They go to school with your kids. These are the same people who are working tirelessly to care for patients in our hospital, and the same people that I am almost certain we're going to have to ask a lot more out of in the coming weeks and months. And so I did want to share just a couple of quick stories. I had a nurse late last week tell me that this would have been a week ago, Saturday night, she spent most of her evening in full protective gear, a respirator hood, a gown, and gloves. And she sat in a patient's room for 2 or 3 hours playing classical music and holding his hand because he wasn't able to have, and none of his family members were around. So she did that as he passed. Just last Saturday night, we had an emergency department full of COVID-19 patients. And we had 2 nurses who spent the better part of an hour, again, in a room, holding a patient's hand, the other one holding a telephone so that her daughter could speak to her and see her as she passed. And so I'd like to tell you those are just or only 2 stories we've had like that, but these are stories that are honestly playing out in our facility on an increasing basis and throughout Nebraska and throughout the metropolitan area. So again, I think it's important that we're all, from a business perspective and from a community perspective, kind of aware of where we are today. And again, we really need your help in helping us to manage this going forward. I would like to introduce Angela Suchsdorf. I think she was maybe having some video problems, but I'm hoping her audio works. We're pretty fortunate. Dr. Suchsdorf is originally from Fremont. She's a Fremont High grad. She's an infectious disease physician. We're pretty fortunate to have an infectious disease physician on our staff. A lot of hospitals our size, most hospitals our size don't have that luxury. She's also on the Three Rivers Health Department board. So she kind of represents today both our organization and the health department. And I'd like for her to talk a little bit about how all of you can help us and the message that we would ask you to take to your employees and your families and friends going forward.
Thank you, Brett. Yeah, I thank you for this opportunity to try to ask for help from our community and all of our business people and our businesses in Fremont and beyond. I agree with everything Brett said today with in regards to fatigue among healthcare workers. We're doing everything we can to take care of everyone. Administration is helping us with distributing staff in the places that we need them most. Doctors got together this morning and we were working on plans on how to distribute care to the outpatient arena so that we can keep our patients out of the emergency department that don't need to be there and out of the hospital that don't need to be there, and try to even take care of patients outside of the hospital that are like in nursing homes that so we can keep them in their homes with home health care or in the nursing homes to provide a higher level of care likely than what everyone is used to. So also causing increased stress on those systems. So healthcare is doing everything we possibly can to take care of this, and but we need your help. We need the help of the community, the residents of our counties, to work on primary prevention, which means preventing the disease from happening at all to those that are susceptible. So that means using masks. So number one, using masks. We, for whatever reason, don't have mask mandates in place, and maybe it's better that we don't. We can have people use them because it's the right thing to do and not because someone's telling us we have to. So we have to express that we care about everyone around us, and business owners have to express that they care about their customers. They want them to be washing their hands and gather in small groups. If they must gather in small groups, and lead by example. So all of us out in the community need to be wearing our masks, and when we are involved with the public, need to be doing that. So we need to work as a community to do this in our businesses. Promote the use of masks amongst your patrons and your workers. I know personally, I ask before I go places, if I have an appointment somewhere, are you using masks? I can't come if you're not using masks. And hopefully, the answer is always going to be, yes, we're using masks to protect you and everyone else. You just don't know when, we don't want anyone getting sick, and we want to use, masks. I have a kind of a hierarchy of mask wearing to protect everyone. I want people to have kind of a worldview, community view, where they are protecting everyone around them because we care about each other. I want you to think about your families. Your families need to continue to go to work. They need to continue to go to school. They're really safe at school. And they're really safe at workplaces that have a lot of rules, like the food processing plants. So we know that works, but we need to make them safer outside of their schools and work. So in families, we want to probably not participate in family gatherings in the near future. Thanksgiving is going to look a lot different, just like everything else. Christmas is probably going to look different, and any other holidays that we're celebrating at this time of year. The individual view is to protect yourself from getting sick, and so wearing a mask to protect yourself from those around you that maybe aren't wearing masks. So that's my hierarchy of using masks. I use the same speech when I talk about getting flu shots. So also get flu shots for all those same reasons, but wear your mask and protect those around you, so that we can take it easy on the healthcare system. We're maxed out, and we're not the only ones maxed out. I've been listening to meetings with other hospitals with their chief medical officers, and we're all in the same spot. We most of the time are running at 100%. So if we're running at 100% now, what's a week or two in the future going to look like, and how we're going to handle 110, 120% of our capacity. So that's going to be an interesting future, and I'm not sure how that's going to look. And but I think our healthcare system is going to adapt, and we will find every way we can to take care of everybody. We have these calls with the state as well that Tara's on as well, where we share strategies for taking care of everyone, expanding our care out into the nursing homes to round out there, transferring from place to place to try to help with surge. Maybe the smaller hospitals are going to take some of the larger hospitals' less ill patients so that we can take care of the really sick ones, those kind of things. So lots of ideas come out of those meetings that even I haven't shared with Brett yet today, which we meet right after this. So I'll stop there, and we'll see where we go from here.
Tara, could I jump back in for a second? I want to say a couple of really quick things. First of all, I don't want anybody to leave here feeling afraid to come to the hospital. We've done a lot of things in the last 6 months to make sure that if you have to come to the hospital, you are safe. We protect our staff, we protect our patients. We have very strict visitor policies, very strict masking policies. So if you are sick and you really need to come to the hospital, we urge you to come to the hospital, and we will protect you there. The fine line is, we are probably at a point where, we would ask people to be reasonable about coming to the hospital when they need to come, and to, visit with their primary care provider, and, just make sure that they really need to come to the hospital. But we don't want people to be afraid to come to the hospital. We will care for you, protect you, and do a fantastic job of doing so. Again, just asking for your help today as we kind of go forward in managing this pandemic.
Perfect. Thank you, Brett. I just wanted to talk a little bit on behalf of the chamber and the business organization, and just really encourage all of you to do the things that they're asking you to do. You know, please encourage all of your employees to wear masks. It's so important. The staying home when you're sick. I know we're going to get some questions in a little bit on that, where what if employees don't stay home? But we'll talk about that in a little bit. But just encourage all of them to do that. If they've had a COVID test, don't let them come back yet. Obviously, let's follow the rules that are in place there. I know so many of you have done an amazing job with your sanitation practices, and I'm sure you're getting tired of it, but just keep sticking to it and keep it going strong. Keep everyone safe and healthy. Try not to have your staff gather in the same room when they eat lunch. You know, obviously when you have those masks off, it's not safe to be together. Have that plan ready. You know, what are you going to do if someone does test positive? I know we've had a lot of business, not a lot, we've had some businesses that it's kind of run through the whole company. So please, please, please have that plan in place before it happens, so you're not scrambling last minute to make that happen. We obviously want to keep our kids in school. I know I personally, with young children, am much better off with their teachers teaching them in school than online and me trying to help them. Math is hard in 4th grade. But really just focus on and practicing as much as you can so we can do that. And obviously, I know all of you want to keep all of your employees there every day. It's hard to not have everybody there. So do the little things to make the big difference in the end. And we will get past this. Obviously, it's hard to see the spikes happen, but we want to make sure we move on and you know, we all stay healthy together. We're going to have some closing remarks from Senator Lynn Walls. And I do want to remind everybody, if you have questions, I know they've been coming in, go ahead and put those in the chat. We'll take a few minutes when Senator Walls wraps up to just get to those questions where Tara, Brett, and folks can answer those for us. So Senator Walls, the floor is yours.
All right, thank you. Well, I just want to start out by thanking a few people, even though I know that you've heard it, you know, before. I think it's important to continue to recognize the work that you're doing. First of all, thank you to everyone who attended today. Your willingness to listen just shows that you care. Thanks, Tara from the Chamber, for arranging this meeting. I really want to thank Tara Ewing and her staff from the Public Health Department for your leadership during this challenging time. Your experience and your expertise is very, very much appreciated. Thank you to the healthcare systems, our hospitals, nursing homes, our frontline workers, our city officials, for the care that you guys have shown to others and your sacrifice. You are working around the clock for our community members, and you continue to provide the care even though we know that you're exhausted and you've already are stressed out enough. So thank you so much for everything that you're doing. I also want to acknowledge, just as Tara Ewing did, our schools, Trinity, Bergen, Fremont Public Schools, Metro, and Midland. You have done an outstanding job keeping our schools open and keeping our staff and our students as safe as possible. So thank you for that. This has been a huge undertaking, and it has been a challenge for all of us. But you have, I feel, stepped up to the challenge. Even when we didn't understand COVID or the impact that it would have on our community, you didn't wait. You didn't sit on the sidelines. I saw everybody take action and take responsibility and make the best decisions that you could to produce positive outcomes, and you continue to do that. I think we're all here today because we have a common goal, and that is to not let this virus control us, but for us to take control of the virus and prevent the spread. Our goal is to keep our schools open and our businesses viable. And as we have heard through these conversations, it will take all of us. We all need to be on the playing field together. We need to be setting examples and taking action to control the spread. So as we move forward today, just remember to be thoughtful of your decisions and conscious that we can't only look at this week or the next week, but we really have to plan and prepare for the next 3 months, 6 months, and beyond. So just continue to positively communicate to others and take the steps needed to keep our community healthy and viable. We can do this, but as Dr. Sixtuff said, we need to do this together. So thank you for joining us, and Tara, thanks for organizing this.
Absolutely. Thank you, Senator Walls. Okay, we did have a few questions come in, and I wanted to get to one of them first. I think Tara Ewing, if you can address for us. There was a question in regards to how long employees need to stay quarantined. So if they get sent home or they're sent home, they take the test, how what's the timeline on how long they need to be quarantined?
Yeah, so unfortunately, right now, there's no way to test out of quarantine. So, quarantine is when you have been exposed to somebody who is COVID-19 positive and you were considered a close contact, meaning that you were around them for 15 or more minutes, 6 feet apart or less. Right now, unfortunately, the quarantine period is 14 days from date of last contact with that positive person.
All right, thank you. There was also a question, I don't know, this might be something I need to get back to the person on, but do you know if they do not tell their employer, are there any liability issues that the employee is at if that employee does not tell them?
No, no liability issues that I know of. But what I could tell you though is if they're not forthcoming with their employer, that then potentially though will impact the employer with the spread because of the contagiousness of the virus. The other thing that I do want to remind people, and I absolutely hate to even talk about it, but it is written into the DHM that if you are positive, you have to isolate for 10 days. And if you don't do that, or if you are a close contact to somebody of a confirmed case, you have to quarantine for 14 days, and that can be fined as a misdemeanor. So I just, I unfortunately, we've had some instances where we've had people appeal, quarantine or isolation orders, and they've been upheld. I don't like to say that to try to, use power or anything like that, but just really to get people to understand the graveness, of the situation. We need folks to stay home during that contagious period so that we're not spreading that out into the general community.
Thank you, Tara. Dr. Skusser, you kind of answered this, but recommendations on gatherings for Thanksgiving holiday, household only, small gatherings. I think you kind of mentioned nothing at all, but you guys want to expand on that just a little bit?
Well, I think it'd be a very risky thing to do right now to gather with people outside of your own household. It's very contagious, and it's contagious 1 to 2 days before you even have symptoms. And so you could get together and spread it to all of your extended family and not come down with anything until like Saturday or Sunday, and you have already spread it all over the place. So, and if your families are anything like my families, I have family members that are elderly, and if I was to give them a virus and they have a 200 times more chance to die of the virus than someone a lot younger. So, that's pretty risky to spread that to your loved ones. So I'm not having Thanksgiving. I'm staying home with my daughter. So that's, by example, I'm not doing Thanksgiving. And my whole family, my sisters are both healthcare workers as well, and they're not gathering either. So, because they're needed at their hospitals too. So, so that's what we're doing. That's what I recommend for everybody else, and I think that's the safest thing to do for everyone.
Perfect. Thank you. I'm actually going to bring in Mark Shepard to answer a question here. Mark, we had a question about schools being the best place or the safest place, but what about sick staff and no subs available? Obviously, I know we have some other educational professionals on here as well, but Mark, if you wouldn't mind answering that for us, that'd be great.
Sure. Thank you, Tara. That is going to be our challenge as we continue to try to keep school in session. We've had relatively low numbers, and our numbers have been relatively the same throughout the pandemic. We did see an uptick this week. I think we were up to 18 students out yesterday with a positive test, down to 16 today, and many more in quarantine than we've seen in the past. But that's really truly reflective. The quarantine is reflective of what's going on in the community and what Tara outlined. Our biggest challenge, as somebody has posed in a question, is keeping our staff in school, but also being able to provide for every classroom. And so we're seeing about the same numbers that we've seen over the years. We probably average about 30% of our staff out on any given day in a normal year, about 30 staff members out which is about 10% of our overall staff. And that's exactly what we're seeing right now. I think today we have 26 staff members out. Our challenge is being able to provide the subs for them. And we've taken a little different approach this year. We've utilized local subs more than we have in the past. Local sub is somebody with 60 hours of college credit. And there's 2 classes that are required that they have to have. But most people that have 60 hours of credit have taken the classes that are necessary, or we can provide them with the class and get them into the classroom as a substitute. We've had some individuals in the community take us up on that. We've also partnered with Midland so that we have juniors at Midland and seniors at Midland. Some are education members or education majors, and some are not. And if they have had the 60 hours, we're able to incorporate them as a substitute as well. To date, I think the most that we haven't been able to fill is 13 subs. So when you look across our school district with about 350 classrooms, they have 13 classrooms without a substitute. We've had to get pretty creative. We've used a lot of our specialists. We've used some of our administrators. We've used some of our teachers teaching from home with a paraprofessional in the classroom, and we'll continue to get creative. I had a communication last night with the Commissioner of Education to see if it would be possible for them to relax one of the requirements in statute, or either statute or rule that would allow us to use a paraprofessional as a substitute. And so we're working on that. We're hopeful that we'll have an answer on that in the next day or so and be able to incorporate that. So, but that is our challenge. And I think we all know how important it is to keep our kids in school. Nobody wants to go back where we were last year. We've been very successful this fall, and our teachers have just done an absolutely amazing job all fall, and we need to continue to support them.
Thank you, Mark. We've got another question here about a son working in a restaurant, and isn't it safe with the new DHM from the governor? So Dr. Skusser, I don't know if you want to take that, or Tara, one of you want to handle that for us.
Well, Tara's much more familiar with the newest DHMs. I think anything that they are doing to keep the workers safer with the size of the table, you know, the number of people that can be at a table and the number of people that can be in the restaurant themselves, and then the care they're taking to use masks. I think that's a very responsible thing to do, and it's much safer than what we have now. 100% safety is not achievable. So, but these are attempts to make it safer for everybody.
And just to piggyback off of what Dr. Suchstorff just said, I would also tell you now that a lot of restaurants weren't requiring masking. So this is going to be one more thing to try to keep the staff and the patrons as healthy and safe as we can. Also, to address your question, what I would say is anytime there's a large amount of people gathering, we don't know where those other folks have been, and we know that them wearing their mask is what protects us, right? So I would tell you that if you have a family member that is working in the restaurant industry, it would be the same thing that we're doing here in public health that we would be doing if we worked, you know, in the retail business or even in healthcare. You need to be self-monitoring for symptoms. And the minute you would not feel well or get any symptoms, you then should isolate immediately and go get tested.
Thank you, guys. A question from one of our churches here. The congregation has gone back to not worshiping in person. Obviously, we can't see in the future, but get your crystal balls out. Is there any guidance for congregations not worshiping? For how long? Through the rest of November, December? Any thoughts on that?
So what I would tell you is with the new DHMs, there's no requirement that says that you can't worship. Just that households have to be sat together and there has to be 6 feet of separation. Now, with that being said, We know that some of our very most vulnerable are the individuals that are going to church or going to worship. So I would tell you that foreseeably through the end of the month, if not even through some of December, I really look for there to continue to be increases in cases with all of the gatherings. So not having that crystal ball, I don't see it any time in the near future of it getting better.
Thank you,
Hey,
Tara.
Tara, on masking real quick, masking works. And I would share the example of, we've cared for several hundred COVID positive patients. We've got 700 plus employees. We've had a number of our employees have COVID as well. In the last 8 months, we think, there's no way to know for sure, but we've only had one staff member contract COVID from a patient, and that was in a home health setting. At this point, knock on wood, we don't think we've had anybody contract in the hospital. And that's because we wear a mask all the time. And patients that come in that might be positive wear a mask. And even in those situations where we've later discovered that somebody was COVID positive that we didn't think they were initially, we haven't had any issues because we wear masks. And so when people ask me, do masks work? Absolutely, because if they didn't, we wouldn't have enough people to staff our organization.
No.
Brett, if I could comment on that as well. I think that's the sole reason why our numbers have remained as relatively low as they have with the school district. And it's probably the only reason we've been able to stay in school, truly. And I can tell you, I wasn't a fan of masking in the beginning, just from the standpoint of, not that they didn't work, but I thought we wouldn't get any education done, that we would simply be chasing masks every day, all day. And that just hasn't happened. Our students have been great. Our staff have been great. Our administrators have been great. And our public has been great as they come in to our facilities for activities. And masks do work, and we'll continue to require them 100% of the time in the schools.
Perfect. Thank you for that feedback, Mark and Brett. Appreciate that. All right, our next question, Tara, if you don't mind going into the essential workers and kind of the policy there. If they test negative, can they still go back if they wear a mask after being exposed? What is the rule there?
Yep. So unfortunately for the state of Nebraska, they never defined any essential workers except for educational workers. So we have no language reflected in our DHM except for educational employees. With that being said, though, we totally recognize and understand that there are essential workers, healthcare being some, our food production workers being some, and obviously our first responders and public service workers. So what I would tell you is there are different rules that go into play with all of those. You cannot ever test out a quarantine. So we have had some that have to continue to go to work completely masked up as long as they are asymptomatic, but they go to work, social distance, do their thing, they're self-monitoring 2 times a day, and then they go home and they're in quarantine at night. What I'll tell you is, unfortunately, we have had some spread. In regards to working within the schools, we have the essential worker clause there, but it also goes back to household contacts of positive folks. That's some of our biggest risk and our biggest exposure. So those are really worked on and worked through kind of as a case-by-case scenario. Does that make sense?
Yes, thank you very much. Another question that came to me was, if you've tested positive in the past 30 days or in close contact with an individual, do you still have to isolate and stay out of work even if you've already had it?
No. So right now, and Dr. Suchsdorf, if you want to add anything to this, please feel free. Right now, we believe that if you've been positive, that you are likely going to be okay for 90 to 120 days, as long as you remain asymptomatic, meaning you don't have any symptoms. So if you were positive here in the last 30 days, let's say that this next weekend, you're going to be around somebody that's positive. You do not have to quarantine again because we believe you have antibodies that's going to last for that time period as we speak. Now, the caveat to that would be if you become symptomatic, that's an entirely different situation. But I also want to remind you, somebody that's tested positive, I mean, they can also have remnants of that virus that can be detected in a lab PCR confirmed test, for several months. So that's why we don't recommend repeat testing after that initial test result. Unfortunately, early on, we had individuals that were positive or that were showing positive for 4 months, and we don't believe they were shedding any virus. None of their family members became sick. And Dr. Suchsdorf, do you want to add anything to that?
I would just add that, yeah, there is no test for cure or test of being negative. Once you're positive, we don't know how long you're positive on PCR, and that doesn't mean you're infectious. We've shown several studies where people are not infectious past about 7 to 10 days, and that's why all of our recommendations reflect that, where you should be home for 10 days after you begin to be symptomatic and positive. That's because we are not contagious after 7 to 10 days. So, but you shed the particles of the virus in your nasal cavity, in your throat, and so the testing is still going to be positive. It's just that the virus is no longer going to be infectious. So I can't emphasize enough that you should not get retested once you're positive. That test is not going to be useful for anybody. So you should just assume that test is always going to be positive, and don't waste our testing materials on tests that don't need to be done.
Absolutely.
Thank you both. We do have a question here about concern about events like Main Street's Christmas events coming up. And I know Shannon Mullen is not on the call, but they are restructuring that. So it's all outdoor. I think they're taking a number of safety precautions. So always a concern, but I'm sure Shannon would be more than willing to answer any questions. If you want to talk to me after or send me a private message, I'll get your information. The last question we're going to wrap up with is to get those crystal balls out again, everybody. And do we foresee local businesses or schools closing if we don't meet a certain number? And what are those numbers? What do those numbers look like?
So what I can tell you is local public health meets with the governor every single week, and we're on several calls together in addition to that. The governor has never been, and I don't want to speak on behalf of the governor, but just kind of sharing what I've found to be true, has not been, I don't believe, a fan of a shelter in place or a mask mandate. So what I would tell you is that is our purpose for having this meeting today, to try to really get everybody's attention so that you can spread this information accurately within your businesses, and help us to really try to contain this. Our goal is not to close schools, but if it comes to a point where we don't have staff, or we do have so much spread that we don't know where it's coming from, that might be a conversation we might have to have in the future. Our hospital capacity, and I don't know, Brett or Dr. Suchsdorf, if you guys want to talk a little bit about that part of the question.
Yeah, I would just say from a capacity perspective, I mean, our issue really is one of staffing more so than beds, and all the hospitals, certainly in this part of the state, have the same issue. Most of us have more beds than we have staff to staff those beds. And, when you look at the number of people in our communities that are COVID positive, we have similar numbers of staff out with COVID. And so that's our issue. And so it's hard to say what our capacity is per se. I would tell you, in terms of normal business, we're kind of what we would typically consider to be our capacity pretty much on a daily basis right now. And so our challenge every day, and unfortunately, I think in the weeks and months ahead, is how do we kind of gradually expand that capacity. Right now, we've been fortunate a little bit in that, we've been able to transfer patients to Methodist Hospital or other Omaha hospitals when we get a little stretched. I'm not sure we're always going to have that luxury in the weeks and months to come. And so that's kind of our challenge each and every day, to figure out how we can do a little more. So again, on one hand, I would say we're kind of at our normal capacity, but we are and will figure out how, and we're going to have to, how we can see more and more every day. And that's, that's a challenge, and it's certainly stressful for our staff who are used to, a certain environment where we have certain nurse to staff ratios and all of those things. But we are figuring that out.
Thank
This
you,
is Dr.
Brett.
Spigsdorf again. So the only thing I would add to that is just everything is going to look different. Healthcare is going to look different. We've already established that we're having to adapt to all kinds of different things. The amount of patients we see every day, there's staff that are being shifted to different parts of the hospital and clinics to fill in, if their part of the facility is not working, like in surgery or something like that, we have to shift to somewhere else. So everybody's adapting and doing things a little bit differently. So we're going to probably have to see that out in the community too. We're obviously the school system has adapted, and to the point where they have to close. That I don't know if you're going to have government officials telling you to close. It may be decisions based on the number of people that are sick and how you can continue to function. And that might be in our businesses too. If you're sick, just don't go out. And if the businesses stay open, that doesn't mean that's the reason to go there if you're sick. So just, a lot of common sense, and hopefully we don't have to close down businesses to help stop the virus. The virus is not going to stop on its own. It's not magically going to disappear. We do have vaccines coming out. Lots of good news about that this week from Pfizer and other companies, but that's not a reason to stop being careful and trying to stop this with all of our other measures. We're going to have to act. We can't wait.
Thank you. I would point out that Christina put something in the chat about Juice Stop working with the schools, colleges, hospitals, and employers and providing a reward system. So bribery works, people. So go ahead and contact Christina or give Juice Stop a call if you're interested in partnering to get your folks to really follow those mask, not mandate, but get to wear their mask and protect everybody. So I want to thank everybody for being on this call today. Thank you to our speakers and professionals for your input. We are always happy to answer questions. So if there are questions that come up after this, please reach out to me. I'm happy to put you in touch with Tara or Brett or whoever is important for you guys to talk to. But stay safe, wear your masks, and thank you for being part of this conversation today.
Yeah, thank you, everyone.